And good afternoon, Planet 417. Thanks for joining us here all of Southwest Missouri. We've got Gayla Prewitt here. She's going to be talking with Carol and I about Missouri's Certificate of Need law. You've probably never heard of it, but you're going to want to. So stay tuned and join us right after this. All right. Thanks for joining in, Gayla. Thanks for being here with us.
Thank you for having me.
So glad to have you here. Carol, back again.
Yes. I haven't got kicked off the show yet. Woohoo!
No. Well, your name's in the title. We can't kick you out. We have to redo all the graphics. So
Otherwise.
probably not going to do that. But anyway. Well, any big news your week?
So little plug. I'm going to be at the Lawn and Garden Show this Friday, Saturday, and Sunday. So
Okay.
really excited about that. Been doing a lot of planting, a lot of preparing, and just real quick, last week we talked.
Wait a minute. Do you have 8x10 glossies so you can do autographs for the folks as they're coming by?
Especially in your outfit.
Maybe.
Open.
You know what? I should do that. Maybe
Yeah.
Will could produce. That would be really fun. So yeah.
Yeah, go meet Carol at the Lawn and Garden Show. Right. Yeah, that's fun. Cool. You were saying.
So, we talked about perceptions of liberals and conservatives last week, and I thought we had a really good conversation. I absolutely enjoyed it. I always think about what we talk about both weeks, now we're on week 3. And part of what we want to do is actually make a difference. And so what I was thinking, Will, is what I'm going to try to do this election season is just post on Facebook, which is kind of my social media, the only one that I use. Yeah, because I'm a boomer.
Yeah.
That's what my kids call me. So.
Well, yeah, it's easy and it's quick. So I'm just going to put things that I'm supporting. So I'm going to tell my friends I'm not going to post negative things about other campaigns or other things that I disagree with, policies, legislations, etc. And if I do that, I'm going to ask my friends to call me on it, because I really want to say I'm supporting this and this is why. Not that I'm going to take a step back from my liberal bent and letting everyone know what I think about things. But I don't want to be negative. And then I'm also going to work on just communicating with friends that are posting some negative things. I'm going to take a step back, maybe not follow you. Maybe we can take a break from each other.
And then you can
pick it up
for 30 days and don't have to unfriend somebody. You can just, I'm just not going to hear that for a little bit. And yeah, that's good. I like that. I think, just keep it positive. Say, hey, This is who I'm for and this is why. That's good. I think they go a long way because I think our discourse has devolved into making everybody look bad and see who can come out looking the least bad.
Right.
That's kind of where we're at, and then nobody's happy.
Right. I committed this law. Well, you committed. You broke this law. Well,
you're all
you broke
terrible
that
people,
one.
So
let's just start with that.
We're all sinners in the hands of an angry God.
It's true.
Yeah.
Well, when you cut people off too, then you don't learn.
Right.
And coming from the news background a long time ago, that's what's so frustrating to me. There's not both sides told where people can make up informed decisions. So I like what you're saying because we used to have civil discourse and learn from each other. We didn't always have to agree, but we would learn. And so I think that sounds amazing.
Well, we'll see. Step 1 in changing
Speaking
the planet.
of that, why don't you tell us all? I mean, we've met, we've chatted. You met Carol 10 minutes ago.
Right.
And but why don't you just tell everybody, first of all, just your background, who you are, where you come from, and a little bit of your story, and then we'll get into the Certificate of Need laws.
Okay, well, many moons ago, before I had children, I used to work in television news, and I worked at the CBS affiliate in the Joplin, Pittsburgh.
I don't think your mic's working.
Oh.
So we're going to have to.
Oh, sorry. We're improvising. Yep. Can you hear me now? Well, what about you?
Oh, you don't need me.
Yeah, we do.
He might sit next to me. Woo! Are you going to be okay?
Oh, we'll see.
Well, now I can just look this way.
Yeah.
I don't have to turn back and forth. But a long time ago, I did work for a CBS affiliate, and I was weekend anchor and weekday news reporter. And so back then, we were kind of a one-man band. We did everything, shot, edited, which they kind of do now again also, but our equipment was much bigger.
Yeah.
So I grew up in Southwest Missouri, so my husband and we moved back to around Bolivar, and we had a little girl by this time, and I was no longer working in the news. So I've been mostly home raising kids.
Nice.
I did teach as an adjunct for a while, students about video production and things like that. So, but yeah, that's kind of some of my background.
And do you want to talk about how you got interested in the healthcare law?
Well, actually, it started during the pandemic. I was out doing video, trying to support people so that their side could be told as well. And this was mostly doctors and nurses. I was out shooting video of the protests against certain things that were going on, and they were going to lose their jobs. And so I kind of made connection with some of the doctors that were wanting to start a hospital in our area. They wanted to open a new hospital, and they found out that they couldn't do that without getting this certificate of need approval. And I had never heard of it before. Ultimately, they had the backing, they had the building, and ultimately it was never approved, and so they couldn't open it. And then about a year and a half ago, I went through a hospital journey myself with my husband, and I really had my eyes open to me what is the lack of appropriate health care. I don't know how else to put it. And there are good nurses and doctors out there, but there's a lot of things that are happening that I think are out of their control. And hospitals, to me, are not a place that are safe anymore because there's not competition. And even the doctors and nurses are not allowed to do a lot of the things they want to do. So my husband got septic shock after treatment from cancer, and ultimately he died after only a week in the hospital.
So sorry.
And there was a lot of things that happened along the way that, in my opinion, shouldn't have happened. And so I feel like we need competition. We need to be able to have a voice as a patient and a family. We asked for things that they would not grant. And when I got his records, there were things that happened that I had no idea about. So informed consent, there wasn't that. And I think we need to have options.
Yeah, now, Gayla and I, we met. She came to one of my estate planning presentations a few weeks ago, and we got to chatting in the lobby a little bit, and she just looked at me and she said, "Do you know what certificate of need law is?" And I took a minute because I had to think back, but I did take healthcare law and policy in law school, and we did cover it. And so I was actually able to pull that out and go, yeah, that's the law that basically says you have to show that there is a need to have a hospital and convince a governmental board or that you can't open a hospital. Right. And so what it really does is it allows all of the other hospitals to get together and say, no, we don't need another hospital. And so it is a stymie on competition amongst hospitals.
Right. And there's been, independent agencies looking at this, like the Department of Justice and the Federal Trade Commission in 2004 and 2008 did a big study, and they came up with that these laws limit competition, they're antitrust, they go against antitrust measures, and they believe that they need to be repealed. So there was also another study in 2015 by some economics professors at George Mason University, and they specifically looked at Missouri, and they had some kind of startling conclusions, in my opinion, about the amount of beds that are available because of the certificate of need. We have like almost 8,000 fewer beds that were available because of that.
So my friend Shauna is on here. She's coming. Shauna's a nurse. She worked in the operating room.
Okay.
So I see her every week. She
Hi, Shauna.
sticks me with needles and gives me IVs and all kinds of stuff.
Right.
And keeps me running. And so she's worked right within the system and obviously agrees with you there.
Well, and I've had some doctors, they won't come out openly, but I've got even some information that a doctor writes me, and she is so for that to be repealed. But they're afraid because if they'll be retaliated against and maybe lose their job if they speak out.
And there's no other hospital
publicly.
to work at.
No.
Right. So I wanted to back up a little bit,
Yes.
And we talked a little bit before the show started today, because I thought to myself, why do we have this law if it's not working? If it's if it's antitrust, if it's in violation of other laws, et cetera. And I just did a super quick search. And can you tell us, or do you need to get me to get out my cheat sheet about kind of why did the law come into effect in the beginning?
Well, I think the first law that was kind of like that was in New York, and I think the late 60s, maybe 69. And originally, it was to control cost, and it was also to hopefully bring more health care to people that couldn't afford it. So the federal government thought, oh, this is a good idea. And so they came up with their own legislation, and then they made it a requirement, the way I understand it, in order to get more federal funds for Medicaid and Medicare, you had to have these certificate of need programs in place.
In your state.
In your state.
Yeah.
And so, but by the late 80s, I think 89, I'm not sure about the date, but it was in the 80s. The federal government repealed it. And according to these researchers from George Mason University, they did so because it wasn't working. It wasn't controlling costs. In fact, it was doing the opposite, or at least it wasn't helping. So since then, all the states had it. Well, 12 states have completely repealed certificate of need laws. 6 or 7 have really gutted them, and even more are looking to get rid of them. Missouri has, I think, like the 21st most restrictive certificate of need law. And it doesn't just affect hospitals, it's also long-term care facilities. If you want to get more expensive equipment like MRIs and things like that, those are also under that. So they have to get approval for all these things. And so, yeah, originally it was supposed to be a good thing, but we've had it now for all these years. And
Right, since 1980, I think, around there.
yes, and so it's people that are much more, educated on the issue than me are saying it doesn't work. It's not working. We need to get rid of it.
Well, and one thing that we talked about too before the show started was just the layers that you have to go through. So if you want to start a hospital, so think of all the planning you would have to do to do that in the beginning, or a nursing facility. There's so much that has to go into that just from a business point of view. And then after you do that you have to fill out an application and tell the viewers about the application cost, because I was really surprised at that.
Yes, and this is on the website of the Missouri Health Department and Senior Services Health Department. So yeah, there's quite an extensive thing that they require these people to do. And then you have to pay 0.1% of the total estimated cost of your project. So say you have a $50 million hospital, which to me is very conservative today. You have to pay up front $50,000 just to apply, and it's non-refundable. So they don't get that money back.
So then after someone applies, then it goes through a review process, goes through a discussion, and then who makes the decision on the application?
Well, ultimately, it's called the Missouri Health Facilities Review Committee.
Okay.
And on the committee, according to the website when I was looking, it requires 2 senators, 2 reps, and 5 appointees from the governor. And now it also looks like the appointees from the governor, they don't even have to be Missouri citizens or residents. So outside people can be deciding what happens with our health care. So ultimately 9 people are deciding if you can have a new hospital in your area or not.
And they don't have to be from your area. So somebody from St. Louis could be deciding about Southwest Missouri.
Exactly. Exactly.
Yeah.
Yeah.
Well, and, my opinion is anytime the government's involved, something's going wrong.
I was looking at your poster.
Teddy Roosevelt would have been all over this. He was our trust buster president, right? Yeah. That's good.
Well, this is just one example to me how hospitals have become business, not about people. And I know you have to be able to turn the lights on, you have to be able to pay people. But what do you think this is worth?
What is it?
Yeah.
It's a disinfectant cap that goes on a PICC line. And if you've ever had cancer treatment or had a family member, a PICC line goes in your artery and it goes to your heart. And a lot of times there's like 3 or 4, I think they're called lumens, but they're openings where they put medicine in.
All right.
And this was the standard of care in a hospital when we were in Kansas. And it was put on every time they did anything, taken off. They're called disinfectant caps. In 2013, the Hospitalist magazine said that this is how you prevent infection or helps reduce infection. CDC said the same thing. The Infusion Nurses Center said the same thing. A hospital in Missouri that my husband was in didn't have these. And I'm like, why don't you have those? Why aren't you using those? I was just shocked. And I'm here. My husband didn't have a lot of immune system left because he'd gone through cancer treatment. And the nurse told me, we have asked repeatedly for those, and they will not buy them for us. So I get on trying to find them online somewhere. Well, I find them online, but who wants to trust an online source with
Right.
So I call in the area all the medical supply places that are connected with hospitals. They all refused to sell them to me because my husband was not a patient there. So do you think that was a business decision or a medical decision?
Right.
And I think it ultimately is why he got an infection.
Right.
And so to me, it's priceless. This
Right.
43-cent cap. That's what we're putting the value on a human life, 43 cents.
Well, and the other thing is, I don't know if anybody else has got a hospital bill, but man, I mean, they're charging for the ibuprofen. They may be charging for the cup that they put the ibuprofen in to hand it to you. I mean, it is insane how detailed those bills are, and just it's astonishing that they'll pass the cost along anyway to the consumer, to the patient.
And this wasn't the nurse's decision.
Right.
They would not listen to them.
Right.
Yeah, the healthcare provider wasn't going to make the decision. Shauna's chiming in again. I'm going to read that. It's a good comment. Yeah, thanks, Pete. Our surgery center was blackballed. We were unable to do insurance contracts because the hospital didn't want us to build an outpatient surgery center. As soon as we allowed the hospital to own 49% of the facility, all the contracts got released just like that.
Yep.
So, yeah, it was just all who's going to control it. Yeah.
I mean, that's what it sounded like to me. It's the big hospitals control the competition. They don't want competition.
Well, and you put some videos together on YouTube, and we
Right.
watched those, and I think you make some good points there. It's like this is like saying if you want to open, I don't know the exact example you use, but
Donut shop.
a donut shop. I was going to go with pizza restaurant, but
We're all about the donuts.
Yeah, donut. Love it. If you want to open a donut shop, you've got to get permission from all the other donut shops before you're allowed to open the donut shop. Well, what are all the donut shops going to say? Well, of course not. They're going to turn you down because they don't want the competition. Nobody does. And we have antitrust laws. We believe in that free market economy because we believe it produces the best results at the best price.
Right.
And this certificate of need law just seems to fly right in the face of that. I do think I kind of understand the original maybe intent behind it.
Right.
Which is we're going to try to force that healthcare away from the population centers and out to the places where we don't have good healthcare. But then, it's out of hand. It gets abused. Anytime you hand somebody power, there's the opportunity and the overwhelming temptation to abuse that power.
Right.
Well, and then also you can see where, the outlying counties and things like that. Also, that you wouldn't just have hospitals available in the more affluent areas of town, like even in St. Louis. You don't want all of the hospitals in the affluent areas and not, in the poverty.
But I would think that the free market economy would control that somewhat. I
agree.
That's kind of how we do things, I think, in our country is if there's not a need for it, normally they're not going to want to open it. So
services follow the need.
Right.
Right.
Exactly. And you're right. I think that was the original intent. They didn't want to have duplicate services, duplicate beds. I mean, we've got a shortage of nurses. We had an organization in this state that fired like 700-800 doctors and nurses during the pandemic. So,
wow.
I mean, I have ran onto I don't know how many people lately that I used to work in healthcare. They aren't there. Mm-hmm. And I feel like if we gave them a place where they could control more what happens with their patients, let doctors be doctors, let nurses be nurses, then that joy of what they like to do and how they like to help people, instead of just looking and I can't do it because my hands are tied, I think they would come back and I think we would have better health care. That's just my personal opinion. But from our experience, something has to change. I don't want another family member having to go and go through what we went through.
Mm-hmm.
It's no fun to have to do a job when you're not allowed to do what you know you need to do.
Exactly.
Yeah.
I think we all run into that.
So, Will, what are your thoughts? as far as you're not as supportive, I think, of government programs as perhaps I may be. But I mean, I have to agree with Gayla. I mean, I think that this is something that why not repeal it is kind of what I'm thinking at this point in time, unless somebody could convince me otherwise. What are your thoughts on the cost of having this in place, and what would we save, do you think, if we repealed it?
Well, I mean, just from a cost perspective,
Right.
you get rid of this board. You don't have to deal with that.
Right.
You reduce the expense of opening a hospital,
Right.
and then you just get some fair competition. But even just repealing this, if we're just talking about healthcare costs, this is a small piece, because
Right.
you've got all the other issues that go into why healthcare costs are out of control.
Right.
You've got insurance companies. You've got government programs feeding insurance companies,
Right.
protecting insurance companies.
Right.
And so anytime you have a basically an unlimited pot of money,
Right.
costs are going to go up. And so as soon as Medicare entered the system in the 1940s, we were kind of doomed. I mean, the handwriting's on the wall. Once you can go to the government and start ringing the cash register, it's $1 for that pill. Oh, now it's $2. Now it's $10. Now it's $100, because the government's just paying out the money. Well, then that throws off the competitive nature that keeps prices honest and honest low, because there's somebody out there that's always going to be a higher bidder. The government's
Right.
always going to be the highest bidder.
Right.
The government's always going to outbid us, so that means costs are always going to go up.
Well, and another thing, a lot of the doctors that were trying to open this hospital, they wanted to allow more complementary care. And I asked for one of those in the hospital that my husband, the last one, and he had that outpatient. But when you're in the hospital, you can't, and they won't give it to you. Well, I even had one of the doctors comment, "Oh, I wish that worked. It's so cheap, we use it all the time." And you know, our FDA states on their website, you cannot use anything but a drug to treat, cure, prevent disease. You're not allowed to use vitamins or minerals or even food. I mean, none of that stuff matters. So, and all those things are patented. So you talk about expenses. So you're not allowed to even use things that maybe would be less cost, more cost effective and more
Right.
effective in your healthcare. You, as a patient or a family, you're not allowed those choices because you're in that corporate
Environment.
system. Yeah.
Well,
I do,
go ahead, Gayla. Sorry.
I do want to make sure that we do mention there is a bill right now, a Senate bill,
Right.
to repeal in Missouri, and it is called, I want to make sure I get the number correct, it's Senate Bill 1087, and it is in committee right now. It's awaiting a hearing. This is not the first time Senator Mike Moon has introduced this. I think at least the last 2 years, maybe 3. It never makes it, as far as I know, out of committee.
And what
So,
party is he with?
he's a Republican.
Okay. I like to point out that I sometimes agree with Republicans. Just
So, but if you're interested and you feel this is something you want to even know more about, I encourage you, viewers, to contact your senator, contact your state representative, and ask them about this. Ask them why it never gets anywhere. And is there a reason? Maybe they have a reason we don't know about. But I encourage you, if this is important to you, if you think this would give you more choices for your health care, to contact them. Especially, you could reference this Senate Bill 1087.
Yeah, well, it's an election year, so a lot of your representatives and
Right.
senators are going to be responsive. So reach out to them. They can tell you who the chairman of the committee is. They can tell you who's on the committee. You can find out who they are. You can contact their offices directly and just say, hey, get this out of committee. At least put this up for a vote. There are a lot of things that we know might not pass,
Right.
but we want to get them on the floor because we want to see people on record.
Exactly.
One of my favorite windmills to tilt at is the fair tax. So I've got my fair tax amendments here, HR 25, pending in the Congress. We know it's not going to pass.
Right.
We know they're not. There's just too many people making money off the income tax system. We know it won't pass. But we want to make everybody up there say, no, we're in favor of the current income tax system. We don't want a better, simpler system. We like what we've got. We want them on record voting against the fair tax bill. Same thing with something like this. Let's put your name on the line, say, no, we're for this law. We're going to vote against repealing it. Let's get them on the record. And that, I think, a lot of times is why things don't get out of committee. It's like, if we get out of committee, we're gonna have to show our colors here.
Yeah. It keeps it silent, and then there's no discussion about it. There's another good organization called Informed Health Choice Missouri. If you're interested in these kinds of issues, and the director, she's going to Jefferson City all the time. She keeps up on the latest, so that might be something if you want to know more about that. I do have also some information about Certificate of Need on my website too that
and
people can click on.
Go ahead and give us that website.
It's www.gaylaprewitt.com, and Prewitt is Prewitt.
Okay.
Awesome.
Oh, we might be able to drop that in the comments, something there too, and make sure we do that.
Yeah, we should. Yeah,
so,
for sure. Well, and also, I assume are there lobbyists that are lobbying for hospitals and things, for the certificates of need? I mean, I don't want to make an assumption that they're doing that.
I don't know that specifically. I do know the Missouri Hospital Association does have a lobbying branch, and I believe it's called Health Pack. And they do say on their website, I believe that's in my video too, that they contribute to, representatives and senators that are favorable to their causes. So, you
and we're
can make
making
your own assumptions.
I was just going to say we're making probably an assumption that's probably correct that association would be supportive of keeping the Certificate of Need law in place.
Well, I would assume so, but I would be making an assumption.
Yep.
I mean, they would be. I think it would be protecting their interest, obviously.
So the interesting thing then to do would be to when it does get a hearing, if it gets a hearing,
right,
attend the hearing and see who speaks,
right?
Because I've testified. At least, I don't know. I've testified before hearings in Jeff City before, and it's interesting to see that because we think of what testimony is,
right?
You watch these lobbyists; they just come in and say, "Hey, I'm John Brown. I'm representing the and we are opposed to this bill," and they'll just leave. And that's it. They just come in and say, "This is who I am. This is who I represent, and we're in favor or we're opposed to this bill."
And that's it.
That's sometimes all they'll say, because that's all they have to say.
Right.
They just say,
the people know who they are.
It's like, "Hey, I'm John Brown. I've got a bag of money, and I'm opposed to this bill."
That's what
and that's sometimes all they're that's what they're really saying.
I'm from this association, and this is our position, and.
Wow.
And everybody gets the message, I think, at once.
And that's sad because that really isn't how I don't think America or our state should be operating, but the reality it is too much that way.
To some extent, it's always going to be a little bit that way.
Right.
The way to combat money, I think, is information, which is why we're here, providing this information, providing whatever information that we get out there, because that's all money does. It just buys the notoriety, buys the TV commercials, gets the message out there. If we can provide the forum where all of the ideas can get out there and everybody can kind of compete on the merit of their ideas, then that money means less. But that also means people have to be paying attention.
Exactly.
And there's so many people that aren't paying attention to what's happening locally, nationally, particularly locally. All of our attentions sometimes focus on these national brouhahas that have nothing really to do with us that we can't have any effect on. But we can make a difference in Missouri. We can make a difference in Southwest Missouri, for sure. And we can definitely make a difference with Certificate of Need laws.
Well, and coming a long time ago, I get so frustrated with the legacy media because these are issues that they should be putting out there. And I watch, and I don't ever see most of the things I know about. I don't ever see on the news. So I think, like you said, it is a lack of information. And once people know these things, I had never heard of this until 2 or 3 years ago. And when someone told me about it, I'm like, that can't be. Surely not.
This is probably really the only goofy law on the books, right? There's surely nothing else out there. I mean, nobody would be proposing anything that would be coming up. That would be something.
Oh no.
So, Will, for our viewers, let's say that viewers wanted to know more about this, of course, look at Gayla's information online, actually do that. And then do we need to do something for our viewers to make it easy? Because people will do things, the easier we make it, the more likely people are to do it. So should we do something, or are we
we're gonna drop her website in the comments, and then we can probably at least on the 417 page, we can drop some more links and some things like that. So if you'll just follow 417 on Facebook, Twitter, Instagram, we'll try to get some more of Gayla's information out there. What's going out there? And
if you need to know who to contact, we could probably do that as well.
Who your rep is. There's some good ways to find out who your rep is, who your senator is.
Maybe just Googling with your zip code address or something like that.
Well, Informed Health Choice Missouri did a really good article on this.
Okay.
And she even has a link on there how you can find your senator.
Oh, okay, great.
So if we had that one up, that would be good.
Okay.
So we got a little work to do when we.
Well, I mean, we have to make it easy. We can't just say
Absolutely.
contact your senator because
Right.
they'll be like, oh, I don't even know who that is.
Right.
So,
No, I understand.
You know, and so what do you guys think is the most effective method of communication to a senator or representative to let them know how you feel on a topic?
Calling.
Yeah, I think calling.
You think is the number one?
Yeah, in Missouri, it's really, really easy to walk into the Capitol and go to their office too. I mean, if you can take a day and go to Jeff City, you can find them, and they'll talk to you.
I don't know if it's true or not, but I've heard if they get 20 or 30 phone calls,
Yeah,
I've heard that as well.
that makes a huge difference because for people to take the time to do that,
Right.
then they listen. So
we
I mean, that's
probably
not
got
that
3 or
many.
4 viewers, so we got a good start right there.
We're 20% of the way there.
That's right.
We're changing the world already.
Yeah. There we go. So you got a big stack there. Is there anything else you want to tell us, or do we get it covered here?
I don't think so. I think
Okay.
you guys had really good questions. I mean, if you want to know more about our whole ordeal, I did write a book.
Hold that
So-
up there.
And it's kind of,
Can you get the camera on there a little better? Here? Vitamin C.
yeah. And there's a link on my website about
Okay.
it. So, but I think it's helpful. It would be helpful for anybody. I have a lot of research in there. And it's not just about certificate of need, obviously.
Mm-hmm.
It's about a lot of different things. We had quite a few different things happen. And I do back up everything. I have our story, but I back it up with research. So there's all kinds of research in the back. So you can look up the sources, and you don't have to take my word for it, is what I'm saying. So.
Well, thanks for coming on the show.
Yeah.
Appreciate you being here.
Absolutely.
Thank you
We're
very
excited.
much.
Yeah.
Wouldn't it be really exciting, like our first few months to change a law?
Yeah.
Would that not be
Wow.
like incredible? I mean,
Yeah,
like,
it might almost justify the name of our show. How about that?
I've teased Will that we didn't finish the name of the title. Carolyn will save the world, save the planet, or at least 10 acres in Southwest Missouri.
Right. I like that.
We'll do something. I think that would be exciting.
Yeah.
Be
Okay.
fun.
Well, we'll give it a shot. I'll talk to the reps I know, my friends. I'll get a hold of them,
And I'll do the same.
Yeah.
That would be
So-
amazing.
And
Thank
we'll,
you.
So we'll,
Yeah,
we'll get
absolutely.
started. Hopefully, our 2 or 3 viewers will get started on that as well.
Well, and your friend that was making
Yeah, Shauna.
comments and stuff.
Mhm.
Yeah.
Yeah.
I mean, she probably knows a lot of people as well.
Absolutely.
If it's something that she feels like should be supported, then I'm super excited.
And come out to the Lawn and Garden Show,
Oh,
and you
yeah.
can meet Carol in person.
Yeah.
She'll sign a leaf for you or something. And we'll be back next week. I don't know what we're going to talk about, but we'll figure it out.
We will. We always do.
Yeah, and we'll be here. Thanks for watching.
Have a
Thank
great
you.
week.